The coronavirus has had an impact on our health in a lot of different ways, and not just for the people who contracted COVID 19. Dr. Bruce Bradley is a cardiologist with Lexington Clinic, and he joins me now. And Dr. Bradley, there's an indirect and a direct impact of COVID 19 on cardiovascular disease. First off, what is the direct impact that you've seen in the past year?
Yeah, that's a very interesting topic, and it's something that we're finding out more about as we discover more about the virus. But I think one of the key findings that we initially were noting is that for whatever reason, it tends to make your blood a little bit more sticky, so to speak, and you have an increased risk of forming blood clots in places that we're not normally seeing and in younger patients. And so that can be an issue in the brain, it can be an issue in the lung beds, it can be an issue in the heart. So if you're forming micro blood clots, that can cause microscopic levels of blood damage in a similar way to what a traditional heart attack would be, but just at a smaller level of artery.
And what about the indirect impact in terms of the people who were maybe afraid to go to the doctor or the hospital but had symptoms?
Well, absolutely. I think we've seen that very clearly demonstrated from data out in New York City when they had a massive rise in cases, and a lot of patients were being found at home, passed away as a result of a major cardiac event, such that the American Heart Association has actually come out with a national awareness program trying to promote patients to rather come in and be assessed either in their doctor's office or the emergency room rather than being at home and worrying about something that may or may not be cardiac, because absolutely there's been a lot of patients that have chosen to manage themselves at home and perhaps have missed the opportunity to salvage some heart muscle damage. I've seen some patients over the last year that have had heart attacks and they just put it off to other symptoms, and by the time they come in they've already had their heart muscle damaged, and it's not something that we can get back. And so even in this COVID time that we're dealing with, the safest place to be for a patient who's having cardiac symptoms is in an emergency room. It's not something that you want to sit at home and try and manage yourself. Rather have us scratch our heads and try to figure out what's going on.
And we often hear the warning signs, the tightness in the chest, nausea, vomiting. Are there any warning signs, though, that we may be missing that could be a sign of trouble that we don't traditionally think of?
Yeah, absolutely. I think we're finding more and more that the traditional risk factors or chest pain description that you're talking about, this heavy weight on the chest, the nausea, the sweating, is more commonly encountered in men who are having a heart attack. And we're finding that more and more when women have heart attacks, they may not present with the exact same symptoms. They may feel it or experience their symptoms in a different way. And it can be something as subtle as increased fatigue, increased shortness of breath, nausea, things that would be easy to chalk off to something else. And again, it's one of those situations where if you're having symptoms and you're just not sure what's going on, that's the time to seek some advice, because the sooner we can intervene, the better the chance for recovery.
And we know the risk factors: unhealthy eating, smoking, the excessive alcohol use, genetics also play a factor. But for some people, there is no family history. And what would you say to those people who are otherwise healthy but may have that hidden danger?
Yeah, again, I think there are a lot of patients that will come into our office with a strong family history, and they'll be very concerned about, does that mean that I'm doomed to have a heart attack? And so genetics plays a role, but it's not the overriding factor, not the only factor. We estimate that about 80% of cardiac events are preventable in aspects like you've highlighted: a healthy diet, increasing levels of exercise, control of blood sugar, blood cholesterol, and blood pressure. And a lot of those last three factors, even if you feel like you're healthy, you wouldn't have a clue what your numbers are unless you were tested. So you could be walking around with a very unhealthy blood cholesterol or a blood sugar for that matter and not be aware of it unless you've had care with a primary care provider or come through to a healthcare provider of some sort and been tested for it. So you may not be aware of your individual risk. genetics is a part of it, but there are also a lot of other factors that patients and healthcare workers can modify both in a positive way and reduce your risk of heart disease developing.
A lot of important information. Dr. Bradley, a cardiologist with Lexington Clinic. Thanks so much for your time.
You're very welcome. Thank you for the opportunity.